So, we are doing a webinar on breaking barriers in cancer. Yeah. So, with almost now 13 years of experience in treating cancer patients, uh, I have come to realize some deeper aspects and how what Hahnemann said that miasm is very important in treatment of chronic disease. I've come to realize how that becomes true. So let me share with you a case to illustrate this with an example. So I have one case of desmoid tumor. So desmoid tumor is a precancerous condition where it's a genetic disorder where patient has multiple polyps in their colon, and this is directly related to the hormonal changes in a female. It was a female patient, and during menstruation, the tumor would swell. She would have very severe pains, and complaints develop. So I took her history and I asked her, as we always do, mental, emotional, physical, genders. Long story short, what I understood is she always felt since her childhood that she was not loved, cared, and not um, looked after by her mother, parents, etc. And so she felt very forsaken, and she felt all her desires were suppressed or repressed. She never had the ability to express her desires. Even now, I can't tell you what my desire or aversion is because actually I don't know, because maybe I like sweets, but I don't know because I don't fulfill my desires. So I feel very let down, disappointed that my mother raised me in such a manner. I gave her magnesium mute. She did well for around um, 1 year. Okay, in 3-4 months, She had significant relief. So she did well on this remedy for 1 year. Mm, the first 3-4 months she did not do well because I gave her high potency 1M etc. and she used to have aggravations. Later on I gave her magnesium Muriaticum with which she had very significant relief. Lot of complaints disappeared for 3-4 months, so she didn't have any complaints only after the 6C. So very significant relief with 6C. And then also what happened is her desire started to come back. She started to feel like eating. She started to have sexual urge. Her relationship with husband improved. All that happened. But then she said, every menses I still have this pain. Every menses I still have this pain. And I was struggling. Magbur had stopped working after 1 year. I was like, what to do now? The main symptoms on which I prescribed Magbur also are improving. So she should improve. But those pains were not reducing and they were very bothering to the patient. So I was just scratching my head and I was looking like this. And then, she just saw me, quiet and doing all this. So what she did is she bent over and she sort of was, searching something down. And then it was an online case actually. I looked in the camera and I saw she had a lot of gray hair and she was only 32, 33 years old. So I said, you have so much of gray hair. She said, yeah, this is the genetic. Since my mother also had gray hair since she was 20s. I also have it since that age. So I took gray hair and then I asked her what are the other genetic constitutional symptoms. What desires and aversions are there? What is your family's dietary habits? What are your family's physical constitutional characteristics? So I repertorized those symptoms: physical, constitution, family, foods, aversions, etc. It was meat, mm, and gray hair, etc. And the remedy that came up was lycopodium. So I gave lycopodium 200. Again, she had aggravation. Then I thought 6C worked in magnesium mure. So I gave 6C. She had a little bit of relief, not significant. So I gave 30. She had severe aggravation. So then I gave 12C. She had significant relief. So these are the challenges that you face in practice when you're treating cancer cases, and especially if you want to give long-term relief. So it's not just symptomatic relief. Till now, what I did in previous webinars was talking about symptomatic relief. How Magmur I found out, how patient felt better after Magmur. But how to go deeper, and reach the actual miasm of the patient and treat the miasm so that the uh, actual tendency of developing this particular disease and this polyps completely vanishes. That is where the whole miasmatic theory of Hahnemann comes uh, 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 at the forefront, and how to use that in practice, and how I have got consistent long-term results, very long-term results from practicing in this manner. That is what I want to share in our upcoming webinar. So please do come and see you all there. Till then, bye bye.